Hello, everyone, and welcome to episode 5 of the Literacy Center of Expertise podcast, brought to you by TIES, the Immigrant Education Society here in Calgary, Alberta. I'm your host, Jeremy Wilson, and I'm joined here today by my co-host, Donna Clark, the lead of the Literacy Center of Expertise here at TIES. Hi, Donna. How are you doing today?
I'm great. Thanks, Jeremy. Happy to be here.
Great. Well, today we will also be joined by Celestina Akinkunmi of the Calgary Immigrant Women Association, otherwise known as CIWA, who will talk to us about the Health Literacy Partnership project she was recently a part of in development at CIWA. Donna, would you be able to introduce our guest?
Hi, I'd be happy to, Jeremy. Let me tell you a little bit about Celestina. She holds a Master's of Science in Public Policy and Management from the University of London and currently works as a settlement and integration manager at the Calgary Immigrant Women's Association, or CIWA. She has over 8 years' experience in the nonprofit sector, and her work speaks to community engagement and development related to Canada's diversified newcomer population. Celestina manages a large portfolio with 13 ongoing programs and several short term 2 year projects at CIWA. She recently finished the Health Literacy Partnership Project, which we're going to speak about today, and is currently working on the Pursuit of Happiness for Immigrant Senior Retirees project. Celestina regularly shares her work with multiple audiences, including students, government officials, and community members. She is a humanitarian at heart, and her passion and determination to help people is what informs her work in the nonprofit sector. She holds her Christian faith very dearly and enjoys spending time with her 3 children and husband. She enjoys reading and has a passion for cooking and decorating. Welcome, Celestina.
Thank you so much, Donna. I'm really happy to be here.
That's great. Just as a start to our podcast here, Celestina, I was wondering, could you give us a brief overview of the Health Literacy Partnership project that you created at CIWA?
For sure. Once again, thank you so much for having me. This is really an amazing opportunity to talk about the project. I really was, and still am very passionate about it. So, the Health Literacy Project arose from an increasing need for improved integration between low literacy refugees and newcomers and healthcare providers. The project was created based on a brief literature review and recent focus groups and previous research that was conducted by CIWA, which revealed that refugees and newcomers face a varied barriers to accessing health services, including language, interpretation, isolation, transportation, cultural, gender, and poverty related barriers. So the barriers that they face, to accessing all these healthcare services cannot be overemphasized. So when we looked at that and we saw all these gaps that are not just structural and institutional, but also financial and personal, we decided at CIWA to see how we can best help newcomers access services and how we can make it easier for them. So we came together as a team, put a proposal together. I would just like to point out too that it's a service delivery improvement type project funded by IRCC. So what that means is there is no direct services to the clients. It's all an indirect way of helping the clients improve access. So when we thought about that, it was easy enough to go to the federal government and ask for funding. And we did get the funding and the project was born. So it was all in a bid to reduce gaps in service delivery when it comes to healthcare navigation for newcomer women and refugees.
Oh, that's fantastic. I think any of us who have taught literacy realize that particularly the refugees and the people who are newer in Canada are going to the doctor a lot, and they need a lot of support when they're doing that.
Yes, absolutely.
Hmm.
So, Celestina, could you tell us who else was involved in the project?
Absolutely. So, what we did when we put the project together, we of course had to, it just wasn't us. So, it was a case of, okay, we've identified these gaps and we know what is happening. So, what? What is the next steps? It wasn't just a case of CIWA being able to do it on our own. So, we knew that a robust partnership had to be created. And it couldn't just be a partnership with anyone. We really took our time and we looked at all the different clinical institutions that we have in Calgary, and we went to Mosaic, the Mosaic Refugee Health Clinic. And the reason why we went to Mosaic was because they are the recipients of refugee newcomers when they come to Canada. So we thought they would be the best fit. We pitched the idea to them and they were on board right away. So they were our partners in this, but that's not to exclude all the other people that we worked with. So when we talked about the Health Literacy Partnership Project, yes, it was a project that was between CIWA and the Mosaic Health Refugee Clinic, but we also had to listen to the voices of everybody who will be impacted. So it wasn't just them, we had to listen to the voices of the marginalized people who are new to the health system, new to English, and new to literacy. And one of the things we thought of was, okay, where do we find these people? And we looked at the CIWA's Pebbles in the Sand program, which basically just has newcomer women who have less than 7 years of education. So we knew those would be our LESLA learners because that was the key demographic that we're looking for. And just to explain, LESLA just means literacy, education, and second language learning for adults. So those were our key audience right there. Another group of people that were an important stakeholder in this partnership were also the literacy providers themselves. So all the teachers who are out there teaching LESLA learners, we had to look at them to say, okay, we need you guys to be on board to see how we can get this project moving forward. So those were our key partners in this project, the Refugee Health Clinic, the literacy educators, as well as the students.
I'm wondering, Celestina, did you find any challenges in getting some of these people involved, and how maybe did you communicate with the LESLA learners that you were trying to address?
Absolutely. We had a lot of challenges and the challenge the challenges weren't exactly from the healthcare professionals because we had rounds and rounds of focus groups before we actually had the project, before we actually started the project. So I think the healthcare professionals knew what to expect and they were all on board because everybody was looking for an easier way to reach the participants, or so to speak, at this point, they are patients. So the patients who are coming to their clinics, who have all of these issues, they were all looking for ways to reach them, and they were very okay to come on board and to see how they can best support us. With the literacy educators, it was the same thing. They talked about how even though they have a strong desire to help their clients, I mean, most literacy educators actually end up being the support network for a lot of students that they teach. Because when they're in the classroom, we found out that students are bringing all this paperwork and things for them to help them translate and for them. So, how do they work around this? If there could be an easier way, then of course they were willing to get on board. Now, the biggest issue that we had was actually the literacy learners, so the LESLA learners. Bearing in mind that we knew going into the project that a lot of them had issues with first language, with English language. Some of them were, they all spoke their first language, but they were not educated in their first language. So it wasn't just about education or having an education in English, it was actually the fact that they didn't have any education or very bare to minimal education in their first language. So focus groups were quite challenging. We had a lot of interpretation support. Kudos to CIWA's interpretation program. They were able to supply as many interpreters as we needed. We held a total of 12 focus groups with the LESLA learners. And the reason why there were so many was because we spent so much time, well, actually the project team spent so much time in conducting focus groups and getting those answers from the clients. Because it's one thing for you to ask them a question, it's another thing for them to actually understand your question and give you the answer that you exactly want. So there were lots and lots of repetition. Even booking interpreters in certain languages was also a challenge for languages that maybe they couldn't find easily and the clients spoke in the classroom. So some of the clients we actually couldn't get them as involved as we wanted. But for the most part, most of our challenges came from the interpretation support that we had to give to the clients. And I would say the most challenge that we faced was towards the end of the project, because by the time we were in the dissemination phase of the project, or actually even the piloting of the tools were done, but midway through the piloting of the project, COVID hit. Yes. So that created a huge challenge for us because we had done most of the work. It was a 2-year project, or actually 2.5 years. So most of the work was already done, but actually getting learner feedback while it was being implemented in a classroom proper, because they gave their feedback initially when we were in the process of creating the tools, because we kept taking the tools back to the classroom, back to the healthcare professionals, back to the literacy practitioners. Is this right? Did you do it okay? Are the wordings okay? Because it's a national project and it wasn't just customized for Calgary, it was supposed to be something that can be used across Canada, regardless of where you live. So taking it back and having that repeat feedback given to us was very crucial. But then when it came to actually having the finished tools used in the classroom, repeatedly it got cut short because COVID hit and everybody had to go into online learning. With the demographic that we had, which is the Leslie learners, it was very difficult for us to engage them online, because at that point we had to look for ways to make sure that they could log in, so they could, because the tools are all very virtual friendly, not a problem to actually introduce it to them virtually, but we encountered a lot of issues with trying to get them to understand what we needed from them when they were not in the classroom, when we couldn't work with them one on one. So that was the biggest challenge that we faced, for sure.
I think there's many teachers out there listening who can sympathize with those challenges right now.
Absolutely.
For sure. Yeah.
Yeah.
But it sounds to me like you did like so much groundwork that actually completing the project was the easiest part, right?
Absolutely, absolutely. There was a lot of groundwork. I mean, we met with 17 ESL literacy practitioners through surveys and focus groups and class visits. And we had meetings with them, we had presentations. And with the Leslie Learner, like I mentioned, we had met with over 31 learners. But overall, I think we actually were able to impact 75 ESL literacy learners through tours of facilities, piloting the tools, and class visits, where it was the actual getting the feedback, because the whole model was meant to be they would sit and one of the project team members would be in the classroom and observe the interaction, as well as we were going to have external evaluators who would come in and do the same. But right now we're in the evaluation phase, but they are having to do it with practically virtually, because there's no way to have what we had hoped for, really.
Right.
Wow, well, congratulations to you and your whole team for managing to get that done despite those challenges. And having looked at the resource quite a bit online, and I've actually used some of the videos in my Literacy 3-4 classroom.
Oh, wow. Thank you.
So it's really great to see that you guys got it done, considering all those challenges. And Celestina, like I said, I had used the videos and some of the resources in my classroom, but would you be able to give us a little bit more background on maybe how can the instructors use the resources in their classrooms, whether that be, online like we're using now, or even in a traditional classroom?
Oh, absolutely. So, for anybody who, of course, would like to access the resources, they are on our, because we had to create a separate website to house these resources. We couldn't put it on our website because that's one of the stipulations from the funder. was to make sure that it was really accessible by anyone. So we created a separate website, which is called the CIWA HLP. It's a health literacy resource website. So if you click on the health literacy tab, it will take you to all the different resources that are available, and there are a variety of them. So I can speak to the simple tools that were created. And right now, we've just finally uploaded the how-to video on the website for literacy professionals who would like to go in and see how they can use the videos in their classroom. So there's a step-by-step process that is on there, recorded by our fabulous project. The lady who was a project consultant, Monica Leong, she has an amazing video that is there showcasing how these tools can be used. But I'll just quickly speak about the tools that were developed, the My Health Passport, the Next Steps Note card, and the My Language card. So what all of them do is actually just explain, like for example, the My Health Passport is just a little guide that you can use in your regular classroom that talks about how a client can keep track of all their information. The whole idea behind it is that their support network is able to help them fill out the paperwork. It contains their emergency contact, their doctors and clinics, any underlying medical conditions that they might have, and the medications they are on. The reason why this My Health Passport was actually created was a lot of the doctors that we had spoken to kept talking about missed appointments. They kept saying how appointments were never being kept. Most of them would miss appointments or they would be late. If we could come up with a tool that can help them remember when their next appointments will be, that would be awesome. So that's how the health passport was actually created. We also one of the things that had come up, not just in our meetings with the medical doctors, but or with the medical practitioners, but also when we talk to the literacy educators, was that a lot of the clients have a hard time telling people what language they speak, just because they are shy, or if they go into a clinic and the clinic starts to talk to them so fast in English, a lot of them just absolutely lose all confidence and are not able to see anything. So we decided to create something called My Language Card. And this card would just says, my name is, and it tells us what they speak, and it says, please help me find an interpreter. And I find that most clinics who keep requesting for the tools, this is one of the ones that they've said has helped them the most, that they really like. And of course, the Next Steps Notepad talks about what sequences clients should be able to do, um, like the actually it's for the clinics, and what it does is it tells the clinician how to write the next steps for the client so that they don't forget. So if you leave, this is what you do, then you do this next, and then you do this next. And the page is ripped off and given to the client. The whole idea is that the healthcare professionals, we always tell them to remember to write the steps in the correct order. Literacy professionals can actually use the next step notepad to have learners practice managing information in multi-step processes. So it's a win-win for everybody. And of course, the six healthcare videos were all created with all the healthcare professional help that we could get, ranging from going to the family doctor, getting a mammogram, blood work, checkups, eye doctor, visiting a pharmacy. All six videos were actually created on site at the health clinics. So we did have amazing support from Mayfair Diagnostics, Crossbridge Pharmacy. When we reached out to all these service providers, they were just excited to help us. So one of the things that they all asked us to was that when the videos came out, we were to give them a short clip of each video so that they could play it in their practices, so that when people come in, they know exactly what's going on. So any educator can actually go on the website and download the videos, and they're able to play them for the clients in whatever language that they would like. The languages are available, the videos are available in seven languages that are all translated. It's voice over video, just so that when none of them have the people actually speaking, everything is all voiceover. It just makes it easier because we got feedback on the scripts from healthcare partners, and of course they all made the necessary changes. And they did tell us that one of the things is just to keep it plain, keep it short, keep it simple, slow and gentle pace. And I find that a lot of people can actually use them in the classroom because I'll say this: one of the teachers who had used the video told us about an Urdu speaking learner who watched one of the videos in English with her class. And then the client went home and was able to watch it again in Urdu. She watched it in English first and then she watched it in Urdu. She came back to class and she was very excited and she told the teacher that she got more out of it rather than when she would have just watched it in English alone. So that's one of the things that we encourage the literacy practitioners to do is to have the clients not just, if you're using them as a teaching tool, let them also experience the videos in their first language and then experience it in English. And you can tell that the comprehension will be a whole lot more. Yeah, so that's what I have. I don't know if you have
Oh,
any
you
question.
I there's so much there. Like it's great that this resource is not only for the students, but it's for the healthcare professionals as well. Because we all need help and training when working with literacy students. So,
Absolutely.
yeah, you have the guide for healthcare professionals. And
Yes.
what I was looking at today is you also have a 165-page teacher's guidebook that
Yes.
that has some worksheets you can do with the students as
Yes.
well, right?
Yes.
And these videos are great. I'm just looking at them now, and they're really topical and exactly what the students need and practical. And they're in Arabic and Farsi and Hindi and
Yes.
Mandarin and
Yep.
Spanish and Tigrinya and Urdu.
Yes.
Are there plans to have any more languages incorporated into this project?
Yes, there are. So that's one of the things we've just put in a short funding request to see if we can have more translations done. And because we already have the script written, it's super easy. All we need to do is just to do the translations, do the voiceover, and then have them uploaded onto the site. So we do have plans to have that done in more languages. I've had a couple of requests from different organizations who have requested for the tools, but do not have the translation capacity. So for sure, we will be looking into doing that. As soon as we have that ready, I will let everyone know.
Awesome.
Yeah, I just wanted to mention one more thing. I know you were talking about the guide for literacy professionals and how it's in all these multiple languages. I just wanted to mention that the worksheets and the storybooks, they are all, everything is very much in sync with the videos. So whatever page that you see, let's say you're watching the video and there's a storybook that goes with it, anybody who watches the video and looks at the storybooks, the whole idea is that the client should be able to match or to understand better what it is that they are writing about. So the storybooks only show a very limited amount of text on each page, contain same clear, full color photos that we lifted from the actual videos when we were creating them. The pages are clean, uncluttered. The text is written in large sans serif font because, of course, literacy experts told us what to do and we did them. So, yeah, just wanted to
That's
mention that.
awesome. All you can tell when you look at that all the details have been attended to for sure.
So much.
Yeah, the voiceover is great, and a lot of resources just put subtitles for the students. But if you have
Mhm.
students who have issues reading in their first language, it doesn't really help them now, does it?
Yeah, absolutely. Absolutely.
So, could you tell us, Celestina, where is the health literacy resource available?
So the health literacy resource is available on if you go to CIWA HLP, you can just Google that. It will take you right onto the page. So that's where we have it housed. Sometimes people go to the CIWA website first. And if you do go to the CIWA website first, we just ask you to click on the resource tab and it will take you to a brand new web page. On there, you will find resources and teaching tools and guide for clinics. And you can just click away, it will show you everything that you need. If you click on the teaching tools, it will show you everything that you want, the resources, it will go take you straight to the videos. So it's all on the CIWA HLP.
Yeah, I thought it was really easy to find. And also we'll put the link to the resource and the notes of this podcast as well for our listeners. That would be great.
Thank you.
Celestina, I just wanted to ask. I mean, like I said, I have used some of the resources in my class, and they're great, and I highly recommend them. And especially the health passport that you mentioned. I think for any low-level literacy teacher, that's such a great resource because we know that students have difficulty organizing important information and then being able to find it. So the health passport is really great, and we urge everyone to check that out. But I want to ask you: have you gotten any feedback from anybody else so far?
Um, Yes, I know we got feedback from Calgary Learns when we dropped them off, and they did pilot. And this was even before the COVID happened. We did send it off to them to pilot. So it's not just CIWA who is actually using the resources, but to have them actually use it and tell us what they think. We did get amazing feedback saying that the resources were really good and they were happy to use it. So far, I have sent them off to so when we did the launch and sent them out, we did the launch and had people attend virtual. Of course, it was a virtual launch, not one that we had expected, but it made more sense because we had more people attend than we would have ever hoped for. So that was a very successful launch. We had people from the states also attend, a number of institutions from the states that wanted us to link them up to how to use the resources as well, which we did. But then within Canada, I think so far I have had 13 literacy um, bodies, so to speak, reach out to me to ask for the resources. And I have given that same information to the external evaluator who is working, a third party evaluator who is working on the actual evaluation of the process of the tools and how it's being used. And I'll have that information much later. But all I've gotten is good feedback. I mean, so far, the people who have taken it from me haven't responded directly to say they like it. Of course, just Calgary Learns and the CIWA teachers we're disseminating the tools at this point. So if you guys would like massive copies sent out to you, you tell me I'm your girl. I'll have them out to you in, in no time. So yeah, I will have more qualitative feedback from my evaluator once it's done. But for now, I'm just getting requests to have the tools shipped out to people.
That's awesome. Yeah, Jeremy and I invited you here today because we think the resource is really awesome as well.
Thank you. Thank you
Yeah,
so
and we've
much.
we've used it, and you can do it online for sure. Um, so I
Yeah.
have sort of our signature question to ask you now. That's a little bit personal, but we like to
Sure.
ask people because it's super interesting. So, Celestina, can you tell us why do you do what you do?
Hmm. That's not so difficult to answer, and thank you for that signature question. I like it. I think my passion for the work that I do actually stems from my family. I come from a very large family. I'm originally from Nigeria, and my father and my mom tended to, well, there are nine of us. Just so to put it out there, I'm the middle child out of, I have four brothers and four sisters. And I remember growing up in this with this massive family, but it was never just us. There was always the extra person that was being helped. There was always somebody that my father said, oh, this person needed help with school fees or this person needed help with that. So it started from that. And we did move around quite a lot. And then I got married to my husband, who, yeah, has a job that makes us move around. This is the second time I'm living in Canada. So, and everywhere I went, because it was almost like uprooting myself and starting my career all over again. I used to be a teacher in the States. I was a special education teacher for a number of years. And then we moved here and then moved to the UK. And I really got more involved in not for profit work when I was living in the UK. And all I just did was volunteer at that time. I'd worked at CIWA before then, but that volunteering and seeing how you can impact somebody's life was what made me decide that, you know what? coming back to Canada, even though I had a master's in public policy and management, and I always thought that I'd end up working in some government office one day, I came back to CIWA and I applied for a job as a settlement coordinator because I really wanted to go back to working in settlement. And I've been there ever since. It's something that's been born in me. It's something that is a part of my was a part of my growing up. My parents still support several charities back in Nigeria. My sister is a pastor who does the same. I still support several charities where I go. And I'm happy to get paid for a job that I love, something that is I'm passionate about. So I really am happy. So that's what informs my work pretty much.
Awesome.
All right. Well, thank you so much, Celestina, for coming on the podcast today and taking us through the Health Literacy Partnership Project.
Thank you so much, Jeremy, for having me. And Donna, thank you so much. This has really been amazing. I've loved talking to you guys. And please feel free to invite me at any time. It might not just be health literacy, but there may be many more things that I'd love to talk about. But thank you.
I'm interested in your project about seniors that you're working on.
Absolutely.
So,
Yes, that would be a
yeah.
nice one for sure. Thank you.
So, everyone, we will again put the link for the Health Literacy Partnership Project up on the podcast site, and you can access it there. And again, we highly recommend that you do so. So, thank you again to our guest, Celestina, for taking us through the project. If anyone out there is interested in becoming a future guest on the podcast, please reach out to us at www.immigrant-education.ca/literacy center/contact, and center is spelled CENTRE. We would also like to thank our funders, Immigration, Refugees, and Citizenship Canada, for their continued support of this podcast. Finally, thank you everyone out there for listening. Until next time.